surviving 10 years of living with cancer. And I invite all of those people in that landmark to join me in ringing the bell. You have to get up. You have two choices. You can lie down and give up, or you get up. And if you get up, we're going to fight. Well, welcome back, everybody. I'm Jack Ostroff. I've been a cancer patient for the better part of 10 years at this point. And but I want to tell you what happened in the summer of 2024, back in June/July. I had, at the beginning of June, I went to Toronto Rehab. I had brain cancer. Had been treated with radiation to deal with the cancer in my brain, but my arm was still in this sort of position. It was pretty much locked, close. Despite the exercise I was putting in while I was still in hospital, I wasn't making much progress. And so it sent me off to Toronto Rehab, and basically I had about a 3-week stay there. And these people are just absolutely remarkable. Over the course of 3 weeks, I went from being sort of almost stuck like this to being able to move my hand and start to get some motion. It wasn't perfect, but all the work I had done with these outstanding professionals had helped me sort of get some mobility in my hand, in my arm. And over the course of the month of July, I started incorporating using my right with my left, unknowingly even. It sort of just came sort of naturally. And over a course of about 3 weeks, it came back to me. And you can see by the motion of my hands, I haven't lost it. It's gone back to normal. And when I consider when I had these seizures, and I was stuck in this position, and they sent me off to the brain clinic, and I'm thinking, this is really not good. There is no way they're going to put Humpty Dumpty back together again here. This is, I'm at the end of the line here. But I was pretty down, and for the first time in this 10-year process, Shauna yelled at me. She says, "What are you doing?" She says, "Don't get down." I said, "We got to fight, and you got to step up." And she was right. Being down and being negative would not help me. It did not help me. I had to sort of change my mindset. I had to start, believing, or at least, being involved in being positive. And after the procedure, the brain procedure, it took a little while. After the rehab, it took a little while. But, the fact that I became more active, I started walking, I started moving. At the clinic, we were doing, I would do walks around Toronto Rehab, and I'd get on an exercise bike. They would take me for walks outside. And all of that exercise helps you with the fatigue. I started feeling more like myself. And then there were specific exercises for my hands. I was involved with, sort of moving and playing with sort of small objects, almost like, what my grandchildren are doing when they play. But it engaged various muscles that I guess had been immobilized during that seizures. And I loosened up, and I was back to myself. I was just in shock. So with all that being said, I think credit to Toronto Rehab. Just outstanding professionals, a great organization. That's the second time I was there. And, over the course of a month, I was back. I was still, not 100%, but I was on my way. And that was something I couldn't conceive of a month earlier. So it was really quite incredible. So don't stop believing. These guys down at the hospital, guys, gals, people, They're really trained professionals. They're outstanding, and not being in the system, and I didn't comprehend the possibilities. So, all I'm saying is, there's some very talented people that, lead to what almost feels like a, miracle to me. And I credit them for their professionalism and their abilities. And I think they're just outstanding. So I just want to take you from the end of my rehab. This is in June. Well, basically got home July 2nd after surgery on my gallbladder where they removed the stones. And again, I mentioned that procedure was state of the art. So these are things that were not available to me, much earlier. But, it was just remarkable that I get out and start living a normal life again. Now, I'm going to start, I'll take you from that point to, pretty much the current date. I just want to, mention that the content that I'm providing on the podcast reflects my personal journey and experiences as a cancer patient. I'm not a medical professional, and nothing discussed in this podcast should be considered medical advice. Always consult with your doctor or qualified healthcare provider for guidance related to your health diagnosis or treatment options. Every person's medical situation is unique, and professional advice should be tailored to your individual needs. So post rehab, so starting in September, my oncologist felt I was ready to start on a new drug. I had finished with cabozantinib, which should help me over a 3-year period. And we started at a very high level of levantinib. That's it uses a different pathway than cabozantinib, and the protocol typically is you start at a very high level of medication, and then they sort of wean you down to find out what's going to work for you. So I first started at 22. 22 just was overwhelming for me. It didn't last very long at 22. This was in September of 24. And I may have tried it for 2-3 months. And there's no way I could tolerate that going forward. By January, I was trying 18. And with 18, it was such that I could manage, but it was more manageable, but it was still very difficult in the sense that I, lost my appetite. Everything was going right through me. So, it's a common side effect of cancer medications. And over the course of 3 months, from January of 25 to March of 25, I lost 20 pounds. So 18 was just not manageable or tolerable. And then they dropped it down to 14. Well, we tried 16. There's not really a 16. So what happens is you take 14 some of the days, and if you're taking 14 in the box, there's enough 4s left over that 4 4s will give you 16. So I would do 18 some days, 16 the others. I was trying to manage through that. The results were actually great. And when I got my second set of scans in May of 25, I had more reduction. So I had a 50% reduction in my tumors in January to March, and from April through to June, another 50%. But the medication was causing me, a fair amount of discomfort in the fact that it just, was having the runs, and that ends up being exhausting. So now I'm on a protocol of my own protocol, if you will. I mean, the protocol is typically 18 or 14, and I'm doing 14 most days, but, I'm left with a lot of, because I do 14, the boxes come in 18, so that leaves you a extra 4 every day. And after 5 days, I can take all 4, which is 16. So effectively, I'm averaging 15. And everything, all my tumors are small. I mean, all the tumors I have are less than 1 centimeter, except for one mysterious tumor. And that's in my pancreas. This is something that's been there for the better part of, I'm going to say, 4+ years. It's on the tail of my pancreas, and I had SBRT on the pancreas, and they didn't believe it was successful. And yet, when they scanned it, and this was more recently, the radiation specialist at radiation oncologist, that's probably the right term, advised me that she couldn't see cancer. She says, not in the pancreas, which is just sort of very bizarre. It shows up as cancerous on my CT scans, but but when my radiation oncologist reads it, she says it's not there. It could be a cyst, it could be some other material, but we don't know if it's cancer. More so, the problem with tumors on the pancreas is there's a reluctance to do surgery on the pancreas because they don't know if they could stop the bleeding if we did the surgery. So at the moment, I have a stable tumor. It's been stable for the better part of 4 years, and we don't know what it is. I could go for a PET scan, which would probably tell us what it is. But even if it was cancer and it's not growing, we're not likely going to do anything about it. The other thing I find that's really interesting is that the lymphoma, levantinib and lymphoma are the same thing, by the way. The lymphoma was successful in reducing all my tumors by 50% in the first 3 months of 25. In the next 3 months, another 50%. And yet, during that 6-month period, the pancreas showed no change whatsoever. So my logic is, if it was cancerous, you would think that would have adjusted or affected the size of the growth in the pancreas, and yet there was no change at all. So what does that mean? Well, I'm basically mystery meat. We don't know what it is. It's not growing. It's not shrinking. It's stable. And it is what it is. And at this point, there's nothing we're going to do about it. So all things considered, I should, based on the original prognosis, I was supposed to be gone after, I'm going to say, 4 or 5 years. I'm here. I've come a long way. It's rather remarkable. So for those of you who are struggling and wondering where the future lies, consider this. I'm on medication that didn't exist at the time that I started this process. I'm 10 years in. I wasn't supposed to be here beyond 5 or 6, or 5 actually, was at the most I was given at that time, back 10 years ago. So from my perspective, I'm in bonus territory. Nobody knows what my life expectancy is, which is just fine with me. I've come a long way, and I'm here. And I'm here to tell you that, why not you? I think what I've learned is, be proactive, do your homework, be active, move, walk, run. The exercise is going to help you through all of this. Even when you're on the medication, the more that you can move and exercise, it helps you deal with the fatigue, which is really one of the challenges you'll be facing. But, as my wife said, as Shauna said, fight. Don't give up. Fight. There's another day. There's opportunity. There's a chance, and there's been some remarkable stories that I've heard of people that started a new medication and literally a month after or next scan, cancer's gone. And that always gives me a sense of hope in the sense that, it happened to somebody. I feel good about that. That means it's possible for others. Maybe it's possible for me. I don't know. I can't go that far. I try and stay in the present. But there are miracles happening every day. And why not you? Why not? You just got to stay in the game. That's part of the rules of this adventure. But you also got to fight, and you got to stand up and be engaged. So for all of you, my compatriots who are going through this, I feel for you, but I also encourage you to be as proactive as you can. And thank you for listening. I encourage you to support kidney cancer research because that may not help us. It takes a while to develop more. But what I'm going to do in the next podcast is talk to you about things that are coming. But the research that we do will help others. And those others could be family, could be friends. We have an obligation to those people. We have the privilege of benefiting from what others have given us in terms of the money and the expertise to get us to this place. So I'm very grateful. And I thank you for tuning in. And I got to tell you, this is now on August the 31st. That was my 10-year anniversary of kidney cancer. We went down to Princess Margaret Hospital, 4th floor, orange room. And we're in a room where people were having their immunotherapy. But there's right at the very front of the room is a bell. And it's a bravery bell. And for all of you who are dealing through this, you've been very brave. This is, it's a challenge. It is for everybody. But it sure felt good ringing that bell. Protocol is that if you're 5 years cancer-free, or perhaps if you finish your immunotherapy, you ring the bell. Well, I'm changing protocol. You get to 10 years, even if you've got cancer, you've survived this far, ring the damn bell. And 5 years later, we'll ring the bell again. Don't let those opportunities to celebrate pass you by. So take every occasion to celebrate with your family. You've worked too hard at this. Every day should be celebrated, and every occasion should be celebrated. So I thank you and encourage you to donate to Princess Margaret Cancer Foundation and to Kidney Cancer Canada. And I thank you very much for listening.